background, of course, to all of this was the Francis report, and within the report you're well aware that there was this scandal of unnecessary deaths, of preventable deaths, of avoidable deaths. Whatever the term we use, clearly things were grossly unsatisfactory.
The event was the Trust's latest initiative in response to the Francis and Keogh reports, looking at how mortality data is measured, what can be done to prevent avoidable deaths, and how mortality data is used. Whilst the statistical data within the Trust doesn't suggest there are currently any issues, Professor Chris Gray is looking for continued improvement.
In terms of our performance as an organisation, if we compare ourselves nationally, we don't have an issue in terms of the numbers. But I think the numbers only tell us part of the story. Every organisation has an issue if we don't look beyond the numbers to think, what can we do better? Where can we improve care? So I would say, yes, we have an issue because we want to do better. If we were to say in response to the figures that appear in the popular press, do we have an issue? Perhaps no, but that's not the purpose. Today is about improvement, it's about bettering the experience for patients.
One of the guest speakers was Dawn Cook, a nurse within the Trust who has been able to reflect on the mortality review from a personal perspective.
Prior to admission, my dad was a very healthy man. He was 87, but he led a very, very full life. He was independent in absolutely everything. Keeping fit and healthy was very important to him. He would go for a walk every day around the village. He'd go for his paper in the morning. In the afternoon, he would always go for a walk around the village. Staying fit and healthy was of prime importance.
Dawn's father died whilst in the care of the Trust after being in hospital for over 4 months. He was admitted after a sudden illness, which was diagnosed as a lesion on the brain. Dawn is now using her personal experience to help the Trust with their strategy around mortality.
We've learnt a lot already from my dad's experience and our experience of a family, because I've been in a position that I've been able to share that within the organisation, and because I'm a nurse myself, it means that I've been able to look at it from a family perspective as well as a professional perspective. We've learnt a lot already, and I think there's still more to learn from it, and that's the purpose of me being here today.
The delegates from across various Trust specialties also heard presentations from Tony Roberts, a clinical effectiveness specialist advisor based within South Tees Hospital's NHS Foundation Trust, and Dr. Helen Hogan, an internationally renowned expert on public health from the London School of Hygiene and Tropical Medicine. The aim was to help those attending use the tools available to them more effectively.
We have developed a process of weekly review of patients who die under our care. What we will do going forward is that we will aim to share that knowledge, the information that we accrue from that review of all of those deaths with our staff, and then look to think about ways that we can better share that with our patients, with their families and with the population. So we need to get that externality, we want to get that externality, but we want to do it in a way that is supportive to patients and their families, supportive to staff, so that we can drive change and drive improvement.